Week after week, we hear the NHS is on its knees. Not enough staff, not enough beds, and not enough money. But despite that, the health service admits it's detaining thousands of people with learning disabilities and autism who do not need to be in hospital.
I've had to hold him while changing his sheets because he couldn't stand up. He was slurring his words. I was so scared that because of all the drugs he was on, in the end he would just die.
That's one mother whose son is still locked up, despite being told he was ready to be discharged 2 years ago. So why can't he and so many others leave? I'm Daniel Hewitt, and this is what you need to know. Before we get into it, remember you can subscribe to us on Spotify, Apple Podcasts, or any podcast app so you never miss an episode. You can also watch full episodes on YouTube and ITVX. I'm joined by our correspondent Peter Smith, who's been speaking to that young man, Josh Standish, and his family. Pete, we've talked about this issue before, and I think on these podcasts we try and focus it on a family or a person to kind of give that kind of human perspective. But I think in this case, Josh's story, from what you've been telling me, sort of perfectly encapsulates from start to finish just how broken this system is for people with learning disabilities and autism. So talk us through how you first got to meet Josh.
Well, we first met Josh about 2 years ago, Dan, and as you say, his story is a microcosm of this whole system for people with learning disabilities, people who are autistic, who have become trapped in a system, trapped in hospitals, behind the locked door of a unit with no way out. We're talking about thousands of people, about 2,000 across NHS England. They're not there because they've done anything wrong. They don't have a release date because they're not serving a sentence. They are there because of their disability, and people might think that is so draconian, that cannot happen in the UK anymore, but that is exactly what's happening. They're just languishing, waiting for the country to provide them with supported accommodation, the right care package to live in the community. A large number of them are perfectly capable of doing that if they had that support, but we don't invest in that support in this country, and so they remain locked away.
How did Josh end up in this place in the first place?
Well, Josh lived at home with his loving family and was raised, had a happy childhood. He went to school, he went to local clubs. But as he approached the 18 years old, becoming an adult, his parents had asked for some extra help. They contacted social services and said, what is available? What sort of help could we get for Josh? His parents were getting older, and it's a very common thing that his parents are getting older. They look for a little bit of an extra hand just with the care that's involved of looking after someone with profound learning disabilities. And Josh was taken away into a hospital for assessment for 3 months. He never came home. During that time, he was sectioned, and he's spent his entire adult life locked up in hospitals. He's now about to turn 22 years old, so we're talking about almost 4 years of this varying degrees of sort of hope his parents have had, of being told that he's clear to come home. We just need to find the right support package for him to live in the community. They say they would happily have him living at home, but it's not as simple as that. A lot of people might say, why don't the parents just take him home? They're saying, now he's an adult, the system takes control. They don't have that advocacy to say that we would have him at home. And they also need that support. And so because that support is not provided, Josh has remained in various hospitals. He's experienced, according to his parents, he's experienced physical abuse at some places. One of the units he was in before that's been since shut down. He's been moved around. Each time he's been given a little bit of hope that now he's about to be released. And when that hope is taken away from him, his mental health has suffered, as it would for anyone in a situation where you're trapped indefinitely. And he's been in this cycle of cruelty.
What is life like, sort of day to day, week to week, for Josh as a detainee, effectively, in this system?
Currently, Josh is in a much better place than he has been. But for the last, few years of him being languishing behind locked doors of hospitals, freedom has been fleeting for him. He spent his 21st birthday in a solitary confinement room, door locked, with a hatch in the door. His parents passing his gifts for his 21st birthday through the hatch. When we spoke to him about 2 years ago, he was cleared to be released into the community. Because no support package was provided to let him live in the community, his health deteriorated. He started regressing. He started to become increasingly frustrated. He was asking, "Why is this happening to me?" He understands that this shouldn't be happening to him. And in the place he was in before, in the hospital he was in before, the response was that he was being restrained increasingly. He was being chemically restrained. That's being injected with tranquilizers to sedate him. We spoke to his parents. They'd recorded some footage of him, which they showed me and will be in our report, where you can see just the contrast about how he was when he was day after day being sedated. Here's what his mum and dad told me about that time in his life.
Lots and lots of drugs that I didn't need. Then he wasn't able to go out. He was being physically restrained.
They have meetings every week, and the first meeting that we had, we was told that he was well over the limits, of roughly around 80% over-drugged, over-medicated.
I've had to hold him while changing his sheets because he couldn't stand up. He was slurring his words. I was so scared that because of all the drugs he was on, in the end he would just die.
That is one of the bleakest things I've ever heard. It seems to me what you were saying before, it's kind of a vicious cycle here of Josh goes in to be assessed, and because he goes in, the assessment effectively is we need to keep him in here for a little while to look after him, see how he's doing. But because then when he's ready to go out, he's nowhere to put him, and we'll come on to that in a moment about the care in the community. But because of that, he then stays in and gets worse, and that prolongs his stay. Mm-hmm. And the longer he stays, the worse he gets, and the further he gets away from then leaving. And this it feels to me like he's trapped in this vicious cycle of the longer he stays there, the worse he gets, and the longer he will be stuck there.
Exactly. There's no way for Josh to get better because he has a learning disability and he's autistic. He's not being treated. So he can't prove himself. He's waiting for this system to provide him with a place where he could flourish and thrive in the community. And the longer he languishes in a unit, it's detrimental to his health. And I think it's important to stress that nobody defends this. The government admits that this is not right. Successive governments have admitted this is not right. No one says that this is the correct practice that we're doing, and yet it's funded by the UK taxpayer. This is NHS England is funding this instead of the funding that could go to the support for care in the community. People, like Josh's parents, have said that they can't understand if the governments agree this is not right. Well, why are they not doing anything to fix it? We've also got some data, Dan, with exclusive analysis by MenCap for us, for ITV News, looking at this, showing that people with autism and learning disabilities like Josh are significantly more likely to be restrained when they are in these settings. So people with learning disabilities and autistic people make up about 16% of the patients in mental health units, but over a third of all restraints are being used against this group of vulnerable people. And we're talking again in terms of scale, about 2,000 people with autism and learning disabilities are currently locked up in hospitals across England.
So these are, Josh is one of around 2,000.
One of around 2,000, that's right. And governments have tried to set targets to release the people from hospital, but government after government has failed.
Let's move on to the government. I know that Josh's mum has kind of almost recorded a question. Her own. You spoke to her and said, has a very good idea to say, rather than us ask the question, let's put that question to the Health Secretary himself. Should we take a listen to this? Is the question that Josh's mum asked the Health Secretary West Streeting.
I would ask him why they're locking away people who have got learning disabilities, and would they lock a 5-year-old child away, because that's what Josh is mentally. And if it was his family, if it was their child, would they be happy with him being locked away?
So yeah, that was the question from Josh's mum. I think one of the purposes when we do this type of journalism, Dan, and you've done yourself when you've been reporting on how people, the most vulnerable people in society are failed, is that they often lack the ability to advocate for themselves. Maybe in terms of our programmes, we don't give agency. Here we wanted to give Josh's parents that agency to put the question directly to the Health Secretary, and we did. We took that exact question, we put it in front of West Streeting, and here's what he told us.
You look at these cases, you think this is not only unwarranted, it's cruel. And that's also why in our 10-year plan for health that we're publishing shortly, we also emphasise the need to shift healthcare out of hospital into the community, not just closer to people's homes, in people's homes, because there are a lot of particularly young people, but also adults who are learning disabled or have autism and other neurodiverse conditions who are hospitalised for really no reason. Care could be provided within the safety, the dignity and comfort of their own homes.
I mean, I try not to be cynical about this, but I mean, I assume that's a script that virtually every health secretary has read out for the past 20 years. I mean, like you said, no health secretary endorses this method of treatment. No one supports this system. I don't know, it feels the moment, and you could probably replace this story with lots of stories at the moment in terms of filling the gap of the sentence. Why can't the government just sort this out and fix it? And it seems to me that surely this is in the gift of the state, of the government, to step in here and say, well, we are going to provide this kind of level of care so that people like Josh aren't stuck? Why historically and why now? What are the challenges to the government actually just doing that?
What we're talking about here is, Dan, is the consequence of cuts, not just to specifically providing funding for people like Josh to live in the community and giving them the carers, but cuts to social care and the lack of provision for social care, the lack of accommodation. It talks about housing, something again that you've investigated for years now, and yet we keep seeing the same failures repeated over and over again. Now, this goes back to 2011 when the Winterbourne scandal was exposed by a Panorama documentary. And at that time, again, everyone was unanimous in saying this is cruel, this should not happen. Obviously, the abuse that was seen happening at Winterbourne was something that was roundly condemned, but also people admitted this is no way for a modern society to be treating our most vulnerable citizens. According to NHS England's most recent figures, around 40% of those 2,000 people with autism and learning disabilities who are locked up in hospitals have no need to be in hospital at all. About 40% of them, they could thrive in the community if they had the right support, care, accommodation. And the previous government committed to reducing these numbers by half. But at the end of their time in office, they were 6 years behind schedule. Now, Dan, if we apply that same target today, MenCap's analysis for ITV News shows the country is now 8 years behind target. But interestingly, we can also report that the current government has opted to change the targets, bringing in a new, weaker target that will actually take even longer to help people out in the community. It's this, I guess, something that people often accuse politicians of doing. If you're not hitting the target, move the goalposts.
Yeah, or make them bigger.
Yeah.
I think one of the things, this is very much something you've led on, and it's work we should be very proud of here. One of the things we've been looking into in the investigations team is kind of almost what happens next. So those people, those families who are fortunate enough to get out of these places and get their loved one into a community setting, whether it's a residential care home, whether it's supported living, it's incredibly mixed bag out there as well. And one of the things we were looking at, and one mum contacted me a year or so ago, and we reported earlier this year, a woman whose son Connor was in a mental health institution like you were describing, was there for 2.5 years, not dissimilar to Josh, but he managed to find a community place, and his mum was, as you can imagine, Josh's parents would be over the moon that she was able to find somewhere else for him to live. You fast forward 2 or 3 years and she finds him eating out of a bin in the middle of the night. He's piling on weight, his mental health deteriorating. All the kind of things that she was worried about and were happening in hospital are also happening in this community setting, which, by the way, is costing around £5,000 a week at the cost of the taxpayer. It seems to me that whether it's people stuck in institutions or in the community, or the vast majority of people with learning disabilities and autism are cared for at home, this system doesn't seem at all to really care about these individual people. Yes, Wes Streeton talks about sorting this out, but isn't the kind of, I don't know, the sort of worrying conclusion here is that the fact is governments aren't sorting this out? And does that say something about the way we as a society see people with learning disabilities and autism?
If you were to judge successive governments by their deeds, you could come to no other conclusion. This situation is not getting better. We've seen when we look at the data that how far we are away from hitting targets, and even if you change the targets, people are still left languishing. I put in the context, if we're talking about a vulnerable group of people in our society, perhaps the most vulnerable group in our society, if you were to change the sort of who we're talking about here, let's say we didn't build enough schools in the country. And so we said that 40% of children aren't getting an education. And we'll just keep them locked up somewhere. People would be rightly outraged by this. This is people, human beings that have human rights. We're not talking about people who are a danger to society. We're talking about 40% of the group that have been identified by the NHS England that could live in the community, live a happy life in the community. I've seen with my own eyes the difference from Josh in the hospital setting, sedated, poor health, regressing. I've seen him when he's out in the community. He gets an hour a day to cycle with his dad in the park, and his mum and dad go to see him, and his face lights up. And we get a chance to speak to Josh, and we asked him, what is it you like about this so much? And the word he chose to use, freedom. But as I say, that it's unfortunate for Josh that freedom is so fleeting, because after his hour is up, he's taken back behind a locked door in a hospital. And I think the word that I'd used is he's trapped. There's no way out. I can't imagine anything more cruel for an individual who has done nothing to deserve this.
Peter, it's just phenomenal and very compelling and powerful reporting. Thank you very much for bringing it to our attention once again. You can see Peter's full report at itv.com/news, and you can look back at his reporting on this last 2 or 3 years. It really is worth looking at. But until next time, thank you for listening and watching this quick briefing. Bye-bye.